This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection Web-Based Education Series. Today's presentation is entitled 7 Ways to Win the PPO Game. Negotiate from a Position of Strength. Practice profitability suffers when PPO participation does not align with market demand, professional goals, and patient mix. Left unchecked, the already complex insurance machine can tighten its grip on your career. Conversely, strategic PPO participation guarantees a profitable and stress-free practice by employing consistent methodology to optimize and streamline network participation, reduce write-offs, attract and retain patients, contract effectively, and maximize reimbursements. As an attendee at today's presentation, you will learn how the PPO industry is changing and what to do about it, the complex issues and pitfalls to avoid when contracting with PPOs, how to prepare your practice to manage PPOs effectively, the truth and myths of fee negotiations, and how to develop an effective PPO participation strategy. Brian Phillips is the Director of Sales and Marketing for 5 Lakes Dental Practice Solutions, a consulting and technology firm helping dental practices develop, implement, and manage a PPO participation strategy to attract and retain patients. 5 Lakes has helped over 2,800 practices nationwide. The company is a 4-time Inc. 5000 honoree as one of the fastest growing private companies in the U.S. For more than 10 years, 5 Lakes has been an industry leader in understanding and analyzing the impact of dental insurance networks on the financial health of a dental practice. Brian has been featured as a guest speaker and columnist for many events and publications on the topic of dental insurance and dental benefits. He is a graduate of Ohio University. Before we get started with today's event and very special presenter, I want to remind you that Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, we invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get your questions answered. If we do not get to your question during the webcast, we'll see that they're answered shortly thereafter. Attendance at this presentation entitles you to receive 1.5 hours of continuing education credit with the compliments of 5 Lakes and AIM Dental Marketing. Shortly following the webcast, you will be emailed a brief survey and quiz to complete and receive your CE, again, at no cost to you. Participants are cautioned about the dangers of incorporating techniques and procedures into their practice if the course has not provided them with adequate clinical experience to allow them to perform them competently. And now it is my distinct pleasure to welcome to the Practice Perfection stage, Mr. Brian Phillips. Hello, Brian.
Hey, Danny. Thank you very much for having me. I'm really excited today. Anytime I get the opportunity to talk about dental insurance, it's exciting. I know that kind of sounds odd, but in my role and with my company, we like to joke around a little bit, and we're kind of nerdy when it comes to the insurance, but it's a complex game, and we try to master it on behalf of our clients every day. So I'm really excited about this. I know we can have a tremendous impact working with the practices. And, what I want to accomplish today is, I want to give, an overview of 5 Lakes and my services and, my company, but also talk a little bit about the industry. What's going on with the payers? It's, it's a strenuous situation. It makes you pull your hair out sometimes, working with insurance companies, but not all bad, and there's ways to make that relationship better, and that really comes from negotiating and working with them from a position of strength, like you said in the intro, which I love that, from a position of strength, and ultimately that's what we're going to accomplish today. So I guess without further ado, let's just jump into it, right?
Let's do it.
So excellent. Well, you stole a little bit of my thunder, Danny. You gave a few points about 5 Lakes, but let me just hit some of those all over again.
Okay.
The 5 Lakes, we're in our 11th year. Ironically, last year, we had a lot of plans, a lot of marketing plans. We're going to go visit the country, go to a lot of dental events, and we were celebrating our 10th anniversary. Well, the day before
what
our
happened?
10th, you know what? I don't know. There's some odd thing that happened in the industry, I guess, or in the world. But in the day before the governor of our state shut us down for the quarantine, or the day after, we were going to have our 10th anniversary party, and all excited. We had a little branded logo, gifts for the staff and everything like that. Well, we never got to have it. So, we ended up having to turn on a dime. We couldn't go to a lot of those events, but we made the most of it. We took that opportunity, last year to really, keep honing in on our offer, our service, rededicate ourselves to our clients, and really, what can we do was our question. What can we do to really benefit our clients, especially in this time? We had hundreds and hundreds of practices all across the country saying, "What do I do? We can't practice. We can only do emergency, and we're not really set up for that." Well, what we started talking about is let's plan for 2021. Let's come out of quarantine. Let's come out of the pandemic better, than we went into it. Let's fix some holes, and let's take a look specifically around the insurance and see how we can recapture some of those losses quick. And ultimately, 2020 turned out to be a great year, and 2021 is off to a tremendous start for us. So you hit it on the head. 2,800 offices, is who we work with right now. Now, the cool thing about that is our services cover the nation. We're in every single state. We actually brought on Hawaii, which is our last state that we were trying to knock down to get all 50. We brought them on in the middle of the quarantine. But so we're all across the country. We also, unique to us, is we work with every specialty. Whether you're perio or endo or oral surgeon, orthodontist, a general practitioner, the pediatric dentist, we got you covered. Every single specialty all across the country. And when you start adding up some of those active clients of ours, it represents a significant amount of revenue. We estimated about $1.5 billion in revenue. That's just, when you start looking at that makes us a major player, when it comes to working with the payers or working with these PPOs. It represents a lot of business. And, and Danny, like over those past, 10 years, we have been patted on the back a few times. You mentioned, the Inc. 5000, the Inc. 500 even for us, 4 times, we've hit that. And that's something we're exceptionally proud of. And, that our services, we've impacted, I have 15,000 providers written on the slide, but I'll tell you, it's more than that. But that's a lot of providers that we've worked with. And you know what? We've learned a few things along the way just by working with all of these groups and all of these providers. But, one thing, just tell you a little bit about Five Lakes and who we are as a company, as a family here. Our mission, we went through a rebranding 2 years ago, and we really wanted to get back to what got us started. And our main mission is to really work with the providers to achieve their financial goals. They got into dentistry, they got into owning a business, for many reasons. And, to achieve their personal financial goals, that's where we effort. And, focusing on the values that practice represents, that owner doctor really wants to instill, and then being able to work towards their goals. That's really what keeps us going. So ultimately that turns into, caring for people who care for people. And that keeps our staff going. And, we revisit that every single day when we sit down and turn the computers on and get to work every day. Now, something that Five Lakes got into is we installed an internal operating system called EOS, Entrepreneurial Operating System. And really what that means is that we hold our team, we measure our teams, we hold each other accountable, to maintain our core values. And of course, on the screen is listed out those core values. We really want to be a client-focused organization. And in order to really be client-focused, we have to make sure we are on point in the way we run our business. So we actively work with each other. We set goals and we achieve them together. It's reward for great performance. It's rewarding just to be part of this great culture. And ultimately, our services are the center of the revenue cycle. And when we bring our mentality, our mission, our vision, these values to the table, it really helps us achieve for our clients. And that's really what makes Five Lakes tick. Now, like I said, we're a little bit nerdy when it comes to to insurance. And we talked about what makes Five Lakes who it is, our culture and vision and stuff like that. But why? Why is there an industry for us? Why is there a space that needs a service like ours? Well, on the screen is a study. The NADP put out. They revise this every so often. This is most recently as of 19. But ultimately, what all those numbers and bars and graphs and what all that means is that over the past 10 years, the access to dental benefits has proliferated. To the point where in 2009, only about 55% of the population had access to a dental benefit. In 2018, going into 19, we're looking at over 80%. And I know the new numbers are coming out and it's going to be around 84, 85%. Just think about that. Across the country, almost 85, 83, 84, 85% of the population is covered under some sort of dental benefit. That could be a commercial plan, most predominantly, and that's what's growing the fastest. That's your Deltas and your MetLifes and that type of stuff. But then, of course, there are government programs, the Medicaid as well. But this sets up a situation where the trend is that there is a benefit available to a patient, and most patients take advantage of those benefits. And the days of opening up your practice, putting a sign out front, and then people come with the cash, they're a little bit harder to get those back right now. So in essence, what that means is, it's hard to avoid insurance, and it's a purposely complex business. So what Five Lakes looks to do is just kind of unravel that for us. But that ultimately is really the big number. That much of the population brings a dental benefit to the table. Now, something else that has really been happening in the industry is partnerships. We've all heard this, that the payers, they partner with each other. There's third-party administrators, there's lease networks, there's programs like Dentamax and a number of others. But ultimately, what we're seeing is that the PPO is the growing portion of the business. The indemnity plans are basically gone. The direct reimbursement programs are basically gone. So the advent of the PPO and the proliferation really is setting it up, for the purpose for organizations like Five Lakes to be in business, to really help practices understand what it looks like, how to work their way through it, and to be in a position of strength again to work with these organizations. Now, a lot of this is data. I'm gonna try to jump out of the charts a little bit here and just kind of get down to brass tacks and have an open conversation about what we can do with the payers in today's market. So there is a little bit of light at the end of the tunnel here when it comes to payers. It's not all doom and gloom. They do represent such a large amount of patients, and the general statistic is that patients who have a dental benefit are 2.5 more times likely to visit a dentist. Sadly, there is a large portion of the population that doesn't take advantage of dental care. And we know that there's been a lot of education into oral systemic health, that going to the dentist, having your oral care taken seriously, can benefit your life all over. But those with dental benefits show up more often. And quite frankly, that's why most practices are heavy into taking PPO insurance, just to have that coverage. So one thing that we say, the takeaway, that insurance participation matters, and it matters more now than ever. But really, what also matters is understanding the uniqueness of the way the payers work with each other and how to set yourself up to benefit from that as opposed to being taken advantage of. So, I always try to throw in the funny slide. It's, this is the battle. It's, the little guy versus the big guy. It's the David Goliath, insert the cliche or the analogy there. But I heard a statistic a few months back that in the heart of quarantine, getting towards the end of the summer, so to speak, United Healthcare had made an announcement that they hadn't had their most profitable quarter in the history of the company. That kind of chaps me a little bit. It, kind of hits me at the core that enormous organization like that, and I don't want to pick just specifically on them, but that they are in a position where they are reaping in the premiums. Their members were still paying. Those that were still employed were still paying, but they had no access to care. Very few of the dental offices were open, except for maybe emergency care. And, there in turn, the profitability of some of these payers just went through the roof. And that didn't translate into a program that looked beneficial to the dentist. Now, many payers started offering some PPE reimbursement at some level. Most of those, if not all of them, have ended now. But it is a situation where we started to see trends where fee schedules were being further reduced, and we're on quite a long time period where reimbursements just in general have been going the wrong way. They're going down. Now, you flash forward towards the end of 2020, and you start seeing employers across the country looking for ways to save money. And one of the glaring areas to save money outside of payroll and things like that was insurance. What benefits do we offer our employees? So everyone's looking for cost savings. And of course, when you start pushing the insurance companies or their selling arms to reduce premiums for the staff, someone has to pay for that. And sadly, that's the dentist. That's the orthodontist. That's the periodontist, the oral surgeon. They get to carry the burden of those reduced fee schedules on that, from those situations. So the battle's real, but we have a pathway to win, to get on even ground, and really, like we've been saying a few times here, start leveraging our roles, leveraging our positions for better reimbursements, better programs that could be available. And I'm a champion for the dental space. I'm hoping to see more advocacy, to really benefit the providers in our country, so that we can have a long-term viability. That the industry of being or the dental industry can flourish and not be brought down to a price war at the lowest level. So the battle's real, but we have ways to fight. So I know I promised to kind of move away from the charts, but I got one more. We talked about the carriers and networks, and there's a lot more payers out there now, and they partner with each other at a tremendous level. We ask clients all the time, like how many plans are you in? How many payers are you in network with? And we usually get an answer, 8 or 10, or unless they're a Delta only shop or something like that. But 8, 10, that's something like that. And inevitably, as part of our program, we go check contracting and really understand it. And we let them know that they're in significantly more plans because of the networks than they thought. A lot of, even to the point where providers are thinking that they are out of network, filing out of network claims and getting paid as if they are in network, because of the networks and the partnerships have really taken a lot of that knowledge away, and the provider's actually in more networks than they realize. Now, when you have that, you also have redundancy. and you have overlap, and you have an office staff that's managing 10, 20, 30, 40 or more fee schedules. That could be tough. So I'm kind of talking on here a little bit about what the payer industry kind of looks like. It's a complex web, and there's that old saying that something about the practice to deceive. Oh, what a tangled web we weave if we practice to deceive. I feel like there's a lot of deception, a lot of misdirection, a lot of information.
Let me ask you a question about that, Brian, if I
Sure.
may. In your experience, how common is it that a practice or a dental team member answers the question, "Are you in network?" incorrectly? They think they're out of network when, in fact, because of these tangled webs of which you speak, they actually are in network. Is that a fairly common occurrence?
It's almost universal, and really the only time that it's not, that situation is if the provider happens to only take Delta. There are certain markets where there's very few opportunities, or few offerings, because someone maybe like a Delta just has so much market share. But really, that's really the only times where they might be right. But almost always, they're in more plans than they realize. And even if they do,
I can only imagine how many opportunities. I know and many of our attendees know that we coach on telephone skills mastery, and one of the scenarios that we work hard with our coaching subjects is the insurance question. And so often people are told, I think erroneously, to try to downplay the importance of insurance and try to convince the caller what a great practice you are. And of course, they're just tapping their foot waiting for you to finish to say, "Yeah, but are you in my program? Do you accept my insurance or not?" And so our approach is to acknowledge it as an important question, and to get the insurance information and just promise them that you'll confer with your benefits coordinator and get back to them with an exact answer, especially once we find out how we can be of service to you, because until you know what they're looking for, their plan may or may not be relevant anyway. But especially if you don't know that you're in network when you're not until you get more information, it behooves you to not just jump at that question. People often, team members with the best of intentions and justification, feel, well, we want to be honest with the caller, and so if they're asking us and we're network and we're not, that's the first thing we want to explain to them. And you're just giving me one more very, very important reason to not answer that question, because you don't really know the answer necessarily, right?
Yeah, that's very true. There is that question: do you take my insurance? And there are obviously practices that yes, we are in network, or they will say, no, that we are not in network. It's the practices just say, they kind of say, yes, we take that insurance, and kind of leave it open as if, yes, they'll take it because they'll file out of network claims. That sometimes can come back to bite them, of course. But another thing that's fairly common is most patients, and this is what I hear talking to providers every day, most of them don't quite understand if their insurance has out-of-network benefits. And if it does, they don't quite understand the value there. There is a lot of opportunity to be out of network and be able to work with your patients. And the practices that are flourishing, that they have the long-term loyalty, that they're able to retain patients whether they are in their network or not. That's kind of like that golden nugget. But I always err on the side of let's just be open, let's tell them, but educate them as well on what out of network means and how it's not an all or none situation where it's all bad. I personally go to a dentist because I choose them. They're not in my dental network, but they file my out of network claims, and and I feel the value is there. So we always encourage people to try to educate their patients as well when it comes to that type of situation.
Excellent.
So I briefly hit on this a little bit, but when we mention things like networks, leased partnerships, those type of words, that's a situation where there's a good population out there that kind of understands that the situation is there, that the PPOs partner with each other. but it's very hard to keep up with it. It changes all the time, and it becomes almost a full-time job. In fact, Five Lakes, developed a research team because it's a full-time job, specifically to stay on top of the way the payers work with each other and the trends that they have. I mentioned 2020, obviously being a crazy year, right? Like I think that's what everyone says when they talk about 2020. It's been a crazy year, but in the dental space and the payer trends, it has been an ongoing moving target. Some major plans out there, Aetna, for example. Aetna partnered with Emeritus back in February of 2020. They also partnered with Principal in the fall of 2020. I was joking around with a practice today, and I was explaining what had happened, in this situation, that they partner, which means your fee schedules are now vulnerable, to being changed. You ask an office staff, if do your EOBs match your claims? And no. Do you get EOBs that say that your claim is being paid by a partner or someone else? And of course, and it becomes very tricky, hard to track down, hard to understand, and everyone's strapped for time. A lot of times it just kind of gets written off, and we're in an industry where we're always writing off, or making adjustments, if you will, to all these claims being paid at different levels. But payer trends have been going crazy. I just mentioned those two things with Aetna, but they also had relationships that were very good that they kind of put on hold. Now, like I said, this has been going on and on and on, and there are situations where Delta, they're the big dog. Well, there's a lot of providers that have Delta Premier, and now they have Delta PPO, which in essence means they don't have Delta Premier anymore. And there are states that have made changes and regulations and rules that are unique for their markets, but also payer by payer, they are different. And to think that a staff would be able to kind of keep up with all of these trends while you have patients that you've already presented a case to, that they're already in care, that they're used to, coming in, for their regular visits, and you're starting to see revenues or collections change, your profitability changes. And, right now, we see so many things that are being affected by these relationships and by the way these payers, are presenting themselves.
Being in a reactive mode can be very costly. Indeed. I'm just curious, Brian, are you going to go down each of these trends in turn? Because if not,
no, I was just going to hit on those couple, but if you have one to talk about, sure.
I'm just curious what you mean when you say Emeritus relationship with Aetna reshuffled their stack ranking.
So a stack ranking is kind of, I'll try to put it in like a layman's terms. Each of the payers that they have a partner or two or three or 10, and there's a preference for which they work. So a stack ranking is in essence the preference. So let's say Aetna was getting claims and they were using Sun Life, as one of their partners, and they're paying off of the Sun Life fee schedule. Well, when they bring in a new partner, let's say in this case Emeritus comes in, and Emeritus may have a less attractive fee schedule. Well, then Aetna, depending on your market, could start paying you off of their new partner's fee schedule and re-rank the way that they relate to the rest of their partners.
But there must be a reason other than low cost, because if Aetna was partnering with a bunch of different relationships, had a bunch of different partners, and the one had the lowest fee schedule, why wouldn't they always base their reimbursement on that fee schedule? Is it got to do with the competitive nature and utilization rates and demographics and the like?
There's a lot of reasons. It could be the time that the initial contracting was put into place. It could be the way that they're accessing the plan. Like you can get through like third-party administrators like Carrington or Connection or Zealous. There's a lot of rules. and not all payers are in every geographic market. So it kind of comes into play. So just kind of like paint a quick picture of this, and I know it's very confusing, but you could join we'll just stay with our Aetna example. You can join Aetna, and then Aetna can basically flag down their partners and say, okay, we have Dr. Joe, and who wants to participate with Dr. Joe? And you'll have someone like Guardian say, yes, we do. Emeritus, yes, we do. Sun Life, yes, we do. And then someone else may not. And you'll all of a sudden be in these networks, in this unique fashion. And, that may be different if you came on board in, 1999 or 2012 or 2021. So a lot of things affect it, the way they do it. But that's, in essence, the way they're prioritizing their payers. So, you start asking staff members, what their trends look like, with their EOBs, and you'll start seeing things like, let's say you have two providers at one office that provide the same service. They send the same claim to patients that have the exact same insurance, and they get paid at different rates because they joined the plans at different times, or that they got into network in a different way. So we start investigating situations like this. One of the things that we do early on is to investigate contracting. How are you and all the providers contracted with the payer? And we oftentimes, almost universally, see that multiple providers, the owner doctor and his associates or her associates, they'll be contracted with the same plans but differently. And that adds complexity, that adds inconsistency, and it can affect your reimbursement. So it's a situation where I guess the thing to take home or take away from this is it's complex. Those relationships, there's like 1,600 different relationships across the country with these payers, and it's a nightmare to try to understand. And there are so many rules and regulations that are different in each market by different payers, and the rules are not the same. What is the rules for Aetna in Texas are not the same rules for Aetna in Ohio. There's different rhyme and reason for the way they work together. So untangling that and understanding it is very hard. And we see practices, that once we get into their practice management system, start looking at some of this data, we start seeing that, we can see what's happening here. This is where you're losing revenue, your reimbursements are changing because you have various relationships that have like a trickle down effect. There's a lot of the 6 degrees of separation, amongst the payers, that relationships, that were set up one day are now different relationships, and that has an impact, quite frankly, to the bottom line, and that can impact your patient relationship as well. So payer trends, it's a tough gig, but we want to, I just want to let you know where things are in the market.
Yeah, so I found that a helpful explanation. Thank you for elaborating on that.
You got it. And so just kind of like moving on a little bit here, because of all this, the reliance on the payers, inevitably the doctor has to credential. And this is usually the start. What do I do? What plans? How do I know what plans I should be in? Should I be in every plan? Do I just sign up with 30 different PPOs? Who's in my market? There's a lot of questions to ask. And credentialing is the start of it. So we walk our clients through a program to help them decide what plans they should be in, what plans they should leave, and what plans that they should recontract with. And contracting and credentialing are quite often universally termed. You form a contract with the payer, And the basic term is called the credentialing in. That's them validating that and allowing you into their network. But we want to ask ourselves, what plans should we be in and why? And do we need to be in a plan? Should we be in every plan? So we walk our clients through that process to make sure that they look at this from a strategic point of view. The worst thing you can do, I say that with hat in hand there a little bit, but the worst thing we could do is just join every plan. A lot of startups do that to get the volume of patients up. Just join every plan. Well, you want to make sure that you negotiate, or you work with a company like Five Lakes to really get you the best opportunities. Set your benchmark higher so that whenever you go to negotiate down the road, you're again in a stronger position, and be able to have the information available to really decide on what plans that you really want to or need to be in. So our process is simple. It's a soup to nuts program when it comes to credentialing. We work with the providers to collect all the documentation, everything that's needed, all those diplomas and W-9s and things like that. We collect all that. We'll fill out all those applications. We'll make sure that they're right, because one thing that happens if you send an application into a payer and there's a quote unquote like a misspelled word, that application gets put to the bottom of the pile and you get to wait and wait and wait, and then eventually you may have to submit it again because they're not doing anything with it. So we fill it all out, make sure it's right, get your signature on it. We'll submit everything on your behalf. And then key to this is that our team will follow up with it all the way until you're approved, you get an effective date. Now, credentialing is a pull your hair out type of situation for a lot of practices. And, we understand that. So it takes roughly, and no one likes to hear this, but it takes, 60 to 90 days on average. Sometimes you can get in sooner. And actually last year there were certain payers that were up over 120 days. So, 60, 90 days, what you kind of expect, but we start really getting on the payers to get the provider in the network. If it passes 60, getting into 90 days, we're starting to ask all the time, to really get the process going. So we have credentialing for you. And, of course, if your team is already got credentialing locked down, then we could work alongside your team as well. But it is a tedious process. So just to kind of put a visual on that lease network discussion that we were having, on the screen, I have Aetna. If Aetna's a plan that you need to be in, if it makes sense, if the answers were yes to the question of should we be in this plan? Well, here's how you can do it. There's 9-10 different ways to get into Aetna. All of these partners, there are third parties like Carrington and Connection, Zealous. There's fee schedule programs like Dynamax. There's direct partners with Emeritus and Principal and Guardian. So you see, I mentioned Emeritus and Principal. They got the green because they're the newest ones. Certain parts of the country, they're also kind of known as maybe having a lower fee schedule than others, and those are the new partners. And then the red one, that's your Sun Life, DHA, Assurant, entity. That was a great opportunity in years past. It doesn't exist anymore. So if you happen to be in Aetna getting paid through Sun Life and you bring on a new associate, they will not be allowed in that optimization that way. And you may have to rethink the strategy around the way you participate. We've even heard as early as recently as today that Aetna has been taking some of these situations and then dropping people off of the plan after their contracts have expired. So anyway, take this and then look at all the other plans, and they themselves have their own networks. Emeritus has got a network of 6 or 7. Guardian's got 7 or 8. Sometimes they're reciprocal, sometimes they're not. But you start seeing how complex it is, why it's a nightmare. But I don't want to make this doom and gloom because there's a lot of opportunity here. So one of the main reasons that we talk about contracting and negotiation and properly credentialing is because it's the heart of the revenue cycle. Revenue cycle is a very hot term right now. There's the DSOs have their director of and chief revenue officer. There's a lot of different things like that, and it's vital. It's extremely important. And you could have a smooth process, and hopefully you do. But it all starts with the contract that you put in place, in terms obviously of the PPO. And if you can start from a better place, a higher negotiated rate, then that makes your revenue cycle all the more fruitful. So we always put it at the center, and that's where we can start expecting, and really make that revenue cycle flourish ongoing. So ultimately, what Five Lakes looks to do is build a strategy. That's number one for you. What plans, how, when, what makes the most sense. And there are a number of data sets. We talked about like how to be in a position to negotiate from strength. Well, the 7 areas that you really need to focus on are the major data sets that the insurance companies use to set fees. Now, one thing that is very clear out there is the payers have a lot of information. They're big companies, lots of money. They have access to information, probably more than you realize, and they also work with each other. As much as they compete, they also work with each other. Now, this is where I always, kind of champion the idea that the dentists need more advocacy, because these payers have this information. They can leverage that information when they're working with you on fee schedules. But the dental space does not have that. And quite frankly, colluding amongst dentists is not a legal practice. But it seems to be okay for the payers to do it. So ultimately, this is where Five Lakes comes in. Let us carry the burden for you. We're going to make sure that your participation is streamlined, that you're in the right plans, that you're contracted within those plans correctly, and that you are receiving best-in-class reimbursements. And we take that from a number of areas. But the 3 parts of our program is you do the due diligence. The analogy I always use is this is the home inspection time. You just bought a house. You got to have it inspected to know what's going on. So we're going to look at the market. We're going to look at the practice. We're going to look at your PPOs, and we're going to do a deep analysis. And this is where Five Lakes shines above everybody when it comes to looking at data and data trends and building our technology-based tools to help provide this analysis. We present that to you. The next thing we do is we implement that. We negotiate. We put the opt-ins, the opt-outs, the credentialing work together. We're still monitoring the industry to make sure there's no changes. We're going to look at your UCR. We're going to really put you in best possible situation. But then what Five Lakes does after that is we want to manage it for you ongoing. We talked about all those trends, all those payer relationships that change. Now, you can negotiate one day, get an increase, and then 6 months down the road, there's a new partnership with that payer, and your negotiations have gone away because there's been changes, and it's in their fine print, in their contracts, that they're allowed to add payers if it benefits their members, add to their network. And that's a major area, a major differentiating factor between just a negotiating program and one that's based on strategy. So ultimately, review it, do the due diligence, implement it, and then preserve the strategy going forward.
Brian, could you give us just a general idea of how flexible these payers are in terms of redlining their contracts? I know that you can negotiate, and it depends on, again, utilization and the demographics, the competitive landscape. But and does it vary by insurance company, or does it vary by situation? To the extent that every company is under the right or the wrong circumstances from their point of view, willing to modify their agreements?
It's a little bit of both. Not all payers are as flexible when it comes to negotiating, or even willing to. Delta Dental, obviously, they're notoriously known for not negotiating. Now, that's not 100% true. Sometimes they will. However, the situation has to be right for Delta.
And that's
if they're in a
geographic
market,
too, right? It depends on which Delta
yeah,
you're talking to, I would imagine.
exactly. If Delta has a very small presence in a market, they have a tough time selling their service to the employers because they'll need to have a minimum number of providers in their network. So that might be a situation where Delta might be willing to move a little bit. Now, the rule of thumb, especially if you're private practice, especially if you're in like more of a metropolitan area, Delta's one you kind of pull off, and you shouldn't really expect too much. But one of the things you really want to decide though is, should we be in Delta at all? Does it make sense? Maybe it doesn't make sense. And when we work with clients, I talked a little bit earlier about providing the options. What plan should you be in? What plan should you leave? Well, if we ever recommend a practice leave a plan, and we do it every single day, we recommend certain plans be dropped. We also provide them a break even so that they can understand the financial impact from our point of view of what that means. Because Delta could obviously, in certain markets represent I talk to practices where Delta represents 85% of their business, and then others where it's 12, and maybe they're willing to drop it, since Delta's, discount might be too much to handle. So, but ultimately you got to use the data, to really understand what makes sense. And that's why we provide our service the way we do. We go through that due diligence phase. And here, we talk about those 7 areas, that this is what puts you in strength, a position of strength, is knowing this information, but also knowing how it relates to the payers. And that's, I guess the secret sauce, if you will, is to truly understand what do your competitors take? And if you're a specialist, what are your referral sources? A lot of patients want continuity if they're going with a referral. Now, when you look at competitors, you look at it from a standpoint of, are we in similar plans? Do we practice the same type of dentistry? Are we the boutique dental, practice, or are we the high volume, low fee one? Now, we want to look to see who we compete against and understand how they participate. Maybe there's opportunities there. Maybe it gives us insight into areas, plans that we want to join or plans we want to leave. Demographics, huge impact. There's been the population area, or areas where population is aging. They're aging out of their dental benefits. Maybe that means you get into membership plans or discount or loyalty plans, things like that. But demographics have a major impact. And when we look at demographics, we look at it from where it is today, but also what the trend looks like. What's 5 years going to look like? So when we work with practices, we want to make sure that we're looking at this from where does the practice want to go? Not just a snapshot in time, and here's how we fix where we are right now, but let's get you to where you want to be 5 years, 10 years down the road. We really want clients for life to really, take advantage of the programs we offer. So in addition to some of those other data sets, employers, obviously, what are they offering as a dental benefit? UCR is huge. We want to make sure that our practices are updating their fees, looking at it every year, at least once a year. And even if it just means the cost of living, tweak, we recommend that. We'll put some strategy behind, adjusting the fees so that they fit competitively. We work with Fair Health, the actual claims data, to understand where the practice is now and make recommendations on code by code. A lot of people subscribe to the set your fee schedule, the 70, 80th percentile, and you're fine. That doesn't work so much anymore. We take a look at it from a code by code standpoint. Let's get competitive. Let's dive into this and really, let's do it right. Let's really look at this. What kind of dentistry do I want to be in? Danny, do you know that payer by payer, some of them have tremendous fee schedules for restorative codes and miserable fee schedules for preventative codes, and vice versa?
it's not across the board, then there are so that's another important decision criterion, right? You want to match up the fee schedule with the work that you like to do.
Exactly. Deciding what plans to be in and how to negotiate. Well, knowing what you do, what the employers are offering, what the UCR looks like on your codes. This all comes into play. This is, we to use the football terms, we're going to play the offensive coordinator role here. We're going to draw up the plays, and we're going to know what all the options are, so that the provider they can be the quarterback here. They can finalize, make the decisions on where we go. But we want to put the whole strategy together. Let us do all that.
And that's another reason. And that's another reason that when the team member who fields that first phone call kind of shoots from the hip with the best of intentions and thinks that they're answering the question honestly, they really need to know the details of the plan. And it's probably not realistic for most team members to be able to rattle off those answers, which is why we offer sort of a 2.0. We call it new patient matrix, where you plug in the specific situation, which you can't do on the fly typically. That's why we coach people to say, well, I'll confer with my dental benefits coordinator and get back to you to ensure that we maximize the benefits to which you're entitled. Now tell me how I can help you today. Because then, armed with those two pieces of information, which is, well, what plan do you participate in? In other words, the caller, what plan do you present with, and what dental needs do you have? You use that, plug it into your little matrix. It may not be so little, depending on how many plans you participate with, and then you come up with a financial treatment plan for the caller. And you can't really do that on the fly. So with a little bit of training, you can respectfully address the quote insurance question and move it aside, albeit temporarily, while you now have the opportunity to connect emotionally and professionally with that caller to find out how you can be of service to them. Because nobody ever calls a dental office solely to find out if they're in their plan. People have more important things to do than just arbitrarily satisfy their curiosity about whether you participate in a plan. They have a dental need or they wouldn't be calling.
Absolutely. I mean, they're asking to spend their money, and they're asking to be a lifetime, patient of yours. Yeah, and that's really, when we start looking at this in terms of, like financial advising. There are a lot of moving parts. There are these aspects that really drive fee schedules, and if you have this information, or if we have this information on your behalf, we have built a case for you, a very sophisticated case that leverages our history, size, opportunities, our knowledge of the space, and we have the data. This is the difference between token improvements and really changing the way your practice operates in terms of its financial success. Now, a couple other major points in those 7 areas that really put you into strength. It's what PPOs are available in your market. We go out as part of our core program. Whether you're in those plans or not, we get an offer from them to present to you. No strings attached. We get the offer, we go back, we get a better offer, and we present it to you. So we say, here's the plans you're in, here's some plans that are out there, and we've already began the negotiation process. Here's, if we recommend you join it, we'll present it to you. But we ultimately want to show you, here is everything that's available to you. And we present this to you through our advisory staff who does this all the time, every single day, thousands of clients, where they see so many trends. They're making recommendations that they know are going to be beneficial to you. And it doesn't mean, we'll call on your behalf and get 2 points, improvement on a reimbursement. This is serious, deep down, data-driven, and humanized on the human side by our advisors who really will walk you through it. It's a great experience for our clients. We get tremendous feedback from our clients on the, especially, what's awesome is when a client will tell you that, you put 10 grand a month back into my pocket. You put 300 grand in this year. It's just amazing. It makes you feel feel, awesome. And, everyone's got, different results, of course, because everyone has different goals and situations that they're already in. But just to kind of wrap up this slide, we want to know patients, what they bring to the table. So we're going to dive into those practice management systems, your open dentals and your dentrics and things like that. We have a data analytics team that can do this all. So we'll carry the burden for you. So we'll review production, see where those trends are, what codes you're producing, where's the money makers, and of course we'll look at the patients with their insurance, so we really can understand your practice as it relates to payers from a 360-degree view. And Danny, a unique thing, we get a lot of fee-for-service practices come to us because they just want to go through this process to see if they decided to accept a plan, what makes most sense. So we see PPO-driven practices, PPO, 50-50, practices, and also 100% fee-for-service. This information, the way we're presented, is invaluable too.
Yeah. I could see why the more business-savvy practices would go through this exercise, just so that they know that the decision they made, either to validate the decision or to give them alternatives. And I often have a similar discussion with people about marketing, where they say, well, I'm testing two different marketing tactics, and the one that's going to get me the most patients or the patients at the least cost, that's the one I'm going to keep, and I'm going to drop the other one. And I pretty much quickly respond and say, well, it's not a horse race. What you really ought to be looking at is, what is a patient worth to you, and how much are you willing to pay for a patient? And if one tactic costs you less per patient, that's great. If the other one costs you more, but it's still far less than you are willing to pay, then you ought to retain both services. So it's just the same logic applies here, I could see.
Now, absolutely. And the next couple slides, just a little glimpse into some of the way we organize information. I'll try to go through it quickly here. But one of the things that we do is we compare all your plans, all the plans at a practice, and we develop a average production per patient based on a plan, and then we compare that off to what the office fee schedule would be if they were 100% cash paying patient. So you start seeing situations where, let's just say $1,000 is the go back. Sorry about that. Say $1,000 your average production on your for a cash paying patient, and same services through a PPO like a Guardian or Sun Life or Delta. You start seeing these discounts. That United Healthcare may average 25% discount. Someone like Delta, 36%. Cigna might be 38%, and it's different in every market. But this is kind of how we look at it, because when we're pulling data, we're pulling all past data, right, to see what the trend or what the histories look like. And then as you move forward, how do we set these benchmarks? And this is one of the areas that we do it at, and we start seeing situations like this. Okay, in this case, these are patients in this column. You have, let's say, 17 patients, in Premier Dental. Well, do those 17 patients, should you consider leaving that plan? Or if you only have 2 patients in a certain plan, it may not be worth it to be in it. Maybe a less is more type situation. So this is just like a sample data, but it really starts showing where we go. We provide a number of reports where we compare all the data, in really understandable language, not just giant spreadsheets, but really how can you understand what the data is telling you, and then have the options. So we'll look at how these plans help attract patients, what your attrition looks like, what your new patient acquisition looks like. And, we start seeing things there. If you're attracting patients, but you're not getting repeat patients, maybe there's something there. Maybe you're not attracting enough patients for where you want to be. So we start putting that into our program. Like, that's a goal to improve the new patient flow. And that might mean being in different plans, or, maybe it's working on your marketing and stuff like that. So, your practice is looked at from every situation. Quick example, of employers. what plan they offer in your market, how many potential patients you have. We kind of look at that from about a 20, maybe a max 20-mile drive around the practice, because most people don't go that far, but they may work in your city. A lot of cities have a transient population, or they have daytime population because of work, and a lot of factors like that. That's where all those market-based items come into play, what the employers or demographics look like. So, it's one of the earliest things that we deliver in our analysis, and quite frankly, we get a lot of practices come to us and to say, can you just do an employer search for us again, just so that we can confirm if anyone's being made changes. There's nothing like not being in a plan that one of your major employers in your market switched to, and all of a sudden you got to go through process with them. So we want to make sure that all of that information up front. One of the questions I get all the time, how long does this take? Well, quite frankly, the answer is this should be an ongoing thing, but to get started, you need about 60 days, give or take, to go through the due diligence. It's collecting this data, collecting fee scheduling, contracting, and employers, and competitors, and demographics, and UCR, and production, and and patients, all that information, and then analyzing it. Takes about 60 days, and then we present that to you, and that's the game plan. Our advisor walks you through it, and then collectively we decide what makes the most sense. Where do we negotiate? Do you want to join this plan? Do you want to leave this plan? We give you all the reasons why, all the data to justify it. We give you our recommendation, and then we work at your pleasure. We work at the pleasure of the provider. And though we have tremendous relationships with the payers, because we do represent a lot of opportunity for them as well, we work at the pleasure of the practice. But implementation takes several months. Sometimes if you're joining a plan, it might be 90 days before you can get in. There's negotiations back and forth. So it is a long game. Just like when you start saving money when you're young, it's a strategy that you employ. But if you stay with the program, if you stay with it year after year, and about 70% of our clients just stay with us year after year, you are always in the best position. You're safe, your strategy is preserved, your fee schedules are guarded, they're negotiated at the time that the nearest window opening, and we'll make sure that you're always participating in the most effective manner that meets your goals. Let's keep that in mind. I mentioned startups earlier. Sometimes they want to cast a wide net over a lot of plans, and that's fine. We'll kind of hone that in and get them the best plans and the best reimbursements, but maybe they have a goal in 5 years that they want to start getting out of plans. Maybe you're in that position right now. You've had a good career, or maybe you're in the mid part of your career and you want to start adding more fee for service. And that's where dropping plans comes into play. But ultimately, we want to make sure that you have a strategy that achieves your goals. And that's going all the way back to the mission of Five Lakes. And it's to help achieve the personal and financial goals of the provider. So just kind of getting into like a little bit of a recap. Here's our core base services around credentialing. We do offer a la carte programs, to be able to join a plan here or re-credential. But we also have monthly programs where we have if your practice fits or your provider fits, we have a monthly program. It's just ongoing. We have a lot of doctors on that. And of course I have a client right now who's got 9 locations that had pulled everyone out of network as they acquired these groups, and came to us about a year ago because they were changing their mind. They wanted to kind of revisit things, and ultimately they had decided that they want to get back into network. So we're taking a lot of providers, getting them in network. It's something like 170 credentialing applications, so something crazy. But so we join plan, re-credential, monthly programs. We also can help with tax ID changes if you're selling or you're buying a practice or you're acquiring. We can help there. when it comes to our core negotiation PPO management programs, we do the analysis, set your strategy, which is the number one thing, and maximize those reimbursements. Make sure you're in the right plans, that your reimbursements are negotiated. We implement that strategy to make sure that the providers themselves actually do what they say they'll do. So we'll help with some EOBs and confirming things, and then ultimately we want to put you into our PPO management program to make sure that you're safe, that you're under support. We can train your staff. We can do billing trainings, a number of different areas that we can really help out to make sure that your staff knows how to bill the insurance, especially if you happen to get a new employee or someone retires, something like that. We can really take the ball there. If you grow, you add associates, we can get them right in the most advantageous program, modeled right in, to join the practice. So build the strategy, implement the strategy, keep your eye on it going forward. So Danny, that kind of brings me to the end. I know we went about an hour, right? So
yeah, we did well. We've got enough time for questions, and that's good because we got a lot of them. Can you share what the offer that we settled on that you would be making, and explain? Usually when we have an offer, it's a specific price, but I think maybe people already understand why. Because your approach is so customized to the needs and situations of each practitioner that you really can't do that. But do you want to elaborate just on what you're offering here?
Yeah, absolutely. And you hit it on the head. When it comes to these programs, a single doctor, one location, is different than 5 providers at 6 locations. So a lot of moving parts when it comes to like building and customizing it, but every practice needs something different. So what I'm prepared to offer, and this is, more than, Danny, you and I have a great relationship. We're doing a lot of good work together, and I think this will really get some people going in the right direction, and they'll yield those benefits. But I'm prepared to offer a 10% off the top discount to anyone who listening in on this presentation. That come talk to us. If we decide to do business together, then I'm offering a 10% off the top discount.
And the thing that you wanted me to clarify is that you have relationships with other organizations and you have offered discounts. This discount is not in addition to that. It would be instead of. But I think you confirmed with me, did you not, that this is the best, the deepest discount that you've offered to date?
Yeah, this is the deepest discount that we can offer, and of course we are endorsed by a lot of organizations, and with some of those come discounts and things like that. We've always given the rule of thumb that wherever the referral comes from, that's who we work with and honor their program. Now, this is a discount that's given directly to the practice. There's nothing else involved, and 100% of the benefit goes directly to you, the practice owners. So we're excited, and one thing I encourage is there's no cost to have a conversation with myself or someone on my staff. Let's have a 20-minute, 30-minute conversation just to see. Let's hear about your practice, what you're up against, and if it makes sense to do business together, let's do it. Let's make some money together.
All right. Well, let's dive into some questions. Thanks for clarifying that, though, Brian. And as often the case, there's some questions here that were asked before you got to the section. So I'm going to go through them. And if you want to elaborate on some, then go ahead. But I don't want to automatically discount them or exclude them because they may have been covered in part during the talk. The first question is, what do you recommend in terms of updating office fees?
Oh, that's a good one. We recommend every year you look at your office fees, you look at it in terms of the UCR, and you do it based on real data. There are surveys out there that that some UCR programs, represent or reference. But you really want to look at it from claims. What are your peers, what are they putting out there into the market? And then decide based on all the other factors, what your demographics look like, what your office fee schedule looks like, in general, the type of dentistry you want to provide. But it should be looked at every year. And at the very least, a cost of living. And if you haven't done it for a number of years, there's, you may not want to jump all the way in and raise them up 100%, but, we kind of make some recommendations there, when we do UCR analysis for our clients, but definitely every year.
Okay, cool. You definitely answered this one, but maybe just a short answer to summarize. On average, how long does it take your company to negotiate and sign up offices in the networks from start to completion? Are there specific insurances that take longer than others? That's actually a good addendum to the question.
Yeah, so that first phase, 60 days on the average to do the due diligence, and then our programs are 1-year programs. So you really want to just kind of think about this in terms of a 1-year investment. We're going to make a lot of changes, and really put you in a good spot. The payers themselves don't always go that fast, and that's kind of why some of the timeline it's a lot of it's based on getting the payers to move. But there are a couple plans that are kind of notoriously slow. Aetna being one, Mavers being one, a few others. I don't want to pick on anyone specifically. I think I've done enough of that. But but for the most part, they're all rather slow. They take their time.
Now, when you negotiate on behalf of a practice, I imagine you're legally obligated to divulge that to the payers. Am I correct in that?
Yeah. So we go through a process right at the beginning. We contract together, and we provide a number of authorizations, and that authorization, just digital signature, except for Cigna, which requires an actual hand signature. But that gives us the permission to talk on their behalf. So we go through that. Plus, we have a BAA agreement for HIPAA.
Next question. Yep. No, that was my next question. And I guess, do you get more respect? Or do you feel that I'm not that you can compare this, but I would imagine that maybe you get a little more respect or a little more compliance when they know they're dealing with an organization, with all due respect to the dentist on the call, an organization that fully knows what they're doing in this regard.
Sure. We do get a lot of compliments and comments like, we enjoy working with your company because you present the information very clear. You know what you're talking about. It's not an emotion game with Five Lakes. It's a down to business negotiation, and we have great relationships with the payers. Very, very rewarding on both ends, but we do get those compliments because that's what we built our business to do, is to be efficient, to be effective, to really dive into the data and present the case. And when we present the case, because of all that due diligence, then we're able to earn the rewards that we get.
At the same time, I wonder if they wouldn't prefer working directly with the practitioners just because of the power imbalance. But that's good to hear. You got to maintain good relations. Next question: does Five Lakes offer verification of benefits or eligibility services?
So we a couple things there. One, we definitely recommend that everybody verify benefits and do eligibility checks regardless. Now, Five Lakes is, we're a growing company as well. We like I said, we've been around a while, and kind of built this industry, our view on this industry, and we're building out our verification program, and to be able to offer that out as a tremendous service, all around. But it really does start with going through like that analysis and getting things in order first. You get that all cleaned up, and then once your strategy and your participation is set, then start moving into making sure the verifications are done. So we're still building out that program. The answer is yes, but we've been doing some beta work on it, and we're looking forward to really launching that. We see great things with the way we're putting it together.
Very good. You mentioned oral systemic health. Are you in a position to observe any trends concerning PPOs offering or increasing their reimbursements for such procedures as screenings, prevention, as well as treatment?
That's a great question, and I don't want to do disservice to the answer. The quick answer is yes, just because of our exposure and the sheer what we see across the board. I personally am probably not the best to answer that directly, but I would love to take that question further offline and then bring in our subject matter experts on that.
Let's do that, because I'll confess that's my question. Because as you know, I'm very much passionate about oral systemic health. I do know that a few years ago they expanded they added treatment codes for scaling and root planing in the absence of deep pockets and bleeding on probing. So that was an encouraging development, and I'm not sure where they are in terms of reimbursement for salivary testing, for oral pathogens, and I think they're reimbursing for oral cancer screenings. Not certain about that, but let's definitely have an offline discussion and learn more about that.
Absolutely.
I think that's really important. Okay. Are you able to provide case studies or references from your clients?
Yeah, that's a great question too. Yes, absolutely. We have a number of clients that in all specialties that are proud to speak on our behalf, and quite frankly, they do a great job. Obviously being through the program. So yes, we can walk through some case studies, which we kind of keep agnostic, for privacy. But we do have a great supply of references that anyone who is considering 5-LACE can talk with.
Do you have cases on your website that people can look at, if short of calling and actually speaking to references?
No, we do not have any currently on our website like that.
Okay. Well, people want them, they can ask for them.
Sure. We do have a great blog. I do recommend people take a look at the blog as well.
Okay. If you want to send us access to that, we can include that in our post email blast to all our registrants and attendees. Be happy to do that. How are you determining specialty fees? I have clients that have numerous providers, endo, oral surgery, perio. So obviously this is a consultant who asked that question.
Mm-hmm. So we do work our services, based on a per specialty basis as well. So we work. I'll tell you, one of the areas we have a lot of oral surgery and orthodontic care. We have plenty of perio and endo as well, but we have tremendous results. There's very unique situations where like orthodontic care is, and the way the payers relate, totally different than it is in general. But we work to do the same analysis, to drive the results for the specialist, to get them to make sure they're being paid on specialty fee schedules, and that those specialty fee schedules are also negotiated and put in the best position. One of the things I love is, we have a few hundred oral surgery clients, including some of the largest DSOs that they grow, they bring on practices. I always joke around. I always say that as you grow, you put people through the practices through the 5-LACE car wash, and we polish it all up and get them often in the best position. But when it comes to like orthodontic care, we've had so much. It's great. We had a layer of billing training in there, and to really help them understand how in orthodontics, where they can unbundle programs, and they can actually bill for the codes that they want to do and how to do that, and really have the benefit. But we ask those same questions: what plans should you be in, and should you take any? But we provide the same service directly to the specialist. So we work with practices that are multiple specialty, multiple office. They mix and match, they cross credential. we work with that all the time. And same thing, we'll put the strategy together and reap the rewards.
Next question is, well, this one could take probably another session to answer, but with how many PPOs should a practice be in network?
Oh, man.
I don't bite them, I just read them.
Yeah, I get it. That's you know what? I get it. That's a good question. It's a tough one. The answer
I
is,
imagine.
Yeah, it is. But you know what? It starts with, what are your goals? And then what is your market? And then what's available to you? Who can negotiate? What's the saturation of patients to that plan? You remember all those 7 areas, those data sets that allow you to, have the position of strength. That's what determines what plans you should be in. You take all that and you marry it to your goals, and that'll decide if you need to be in 1 plan, 7 plans, 22 plans, or or not. So.
Mm-hmm. Here's a question I meant to ask, so I'm glad the viewer caught it. It was one of those 7, I think. I see that you're developing a custom solution for providers with United Concordia. What does that mean? And I guess the corollary to that is, are you looking to do similar relationships with other providers?
So, I kind of wish I had some background a little bit there too. But so United Concordia is a payer that we have a great relationship with them. They are great people. Now, they've kind of built that, or had that reputation that they may not pay as well. And okay, I can see why. They can see why. They have a certain business model and they kind of stick to it. But over the past couple of years, we have reached out and they've reached back. Like, how do we work together here, as opposed to it being a confrontational situation? Because we don't want our services to be confrontational with the payers. And United Concordia and Five Lakes, I think, that's the best example where we've been able to work with a company that really wants to come through for their patients and open up their eyes to the payer, or to the provider side, and they opened up our eyes to to what they're up against, and we've been able to achieve some improvements and really put both companies in a great position. And when you add in the provider as well, it's a win-win-win. But to kind of get into specifics, that would take 7 more sessions.
Yeah. Okay. And you kind of answered there was another question. Do you work for the PPOs? And you kind of said you work with them. You don't work for them. Your advocate, your client is the provider.
Absolutely.
All right. Are you able to help with transitions or acquisitions?
Oh, yes. You know what? I love it. I'm glad you asked that, because absolutely we work with practices in transition, they're acquiring, or even a de novo or a startup. But we work with all the time, and there are a lot of unique situations. When it comes down to changing tax IDs, or is a selling doctor staying on board, or where are the associates? Is it a first practice, or is it we're adding it to the group? A lot of different moving parts, and as complex as the payer industry is, there are a lot of situations that can get you into trouble by not working through the plans the most effective way. So we can help with making sure that you are covered, that you don't lose some some certain gains, that you don't get put into a entry-level fee schedule, or based on the way one provider's credentialed compared to the way maybe you're credentialed. There are a lot of potholes in that road.
Yeah, but we had a specific example of that with that practitioner in Arizona, right? About the Delta Premier versus.
Oh, that's right.
How it's handled. Yeah, you could automatically think you have an asset and lose it the day you sign on the dotted line.
Yeah, people don't like when I tell them that almost universally you're going to lose Delta Premier because most of the time they will come a little too late for help, but there are solutions. And I encourage people, if you are in a situation where you're either doing a startup, you're in transition, you're acquiring, maybe a de novo type start, whatever it is, have the conversation with us early. 6 months before the acquisition, if possible, or even if you have an LOI out. Let's talk about it, because there's some services that we can provide to really make that either that transition go smoother or put you in a better financial position.
Okay, we have 4 more questions. I think the next one you've already answered, which is that you do work with groups and DSOs. Do you want to elaborate on that?
We work with everyone. All specialties, private practice. I have a startup and some of the largest DSOs, but ultimately everyone comes to us for different reasons. But the main reason is we can build the strategy wherever you are in your career or the size of your organization.
How do you support the dental industry outside of your direct service offering?
Oh, that's great. I don't get that kind of question very often, but I love it. Well, you know what? We're active. We support a lot of organizations. We a lot of associations. We sponsor it. We try to offset costs for providers to be able to go and get more education, make it more advantageous. We speak at a lot of events. We also do some some CE work. Things like this. We want to expand and grow the dental space. And one of the ways that we do that is we feel like partnering and participating with a lot of the organizations, a lot of the events, and really just being a good member of the dental community.
Yep, and that's similar to our philosophy too. And when we stick to our knitting, we being AIM Dental Marketing, we're charged with attracting patients and helping you communicate with prospective patients to convert them into patients. And then your job is largely about maximizing patient value of the patient to the practice and the practice to the patient. So, to the extent that the practice is optimizing their relations with these payers, then our services kind of go hand in glove. And that's why I make people like you available to our constituents, because we know that what we do is essential to success, but it's not sufficient for success. And it sounds like you share that philosophy, which obviously resonates with me. Well, that's all for the questions. Brian, I want to again thank you very much for making what could be a dry subject very interesting and valuable, as well as for the generous offer that you made to our viewers. And I just want to remind everyone that in a few days you'll receive an email with instructions on how to receive your CE credit. Again, with the compliments of 5 Lakes and AIM Dental Marketing. Now I want to invite you to mark your calendars for Thursday, May 27th, 6 p.m. Central Time, when my guest will be none other than the GEMS guy, Dr. Tom Orent, who will share 13 things to never say to a dental patient and what you should say instead. Don't miss this opportunity to hear from one of the true masters of dental patient communications on Thursday, May 27th. Until then, this is Danny Bobrow, thanking you for your ongoing commitment to practice perfection, and with special thanks to you, Brian. Goodbye, everybody.
Thank you, Dave.